and welcome to Heard It Health. I'm Katie Adams, a reporter with MedCity News, and I'm joined by Dr. Katherine Saunders, the co-founder of Intellihealth, a company seeking to redefine obesity treatment. So can you tell me, what misconceptions does the U.S. healthcare delivery system currently have about obesity treatment?
Sure. Great question. There are many misconceptions about obesity treatment. We've definitely come a long way, but the biggest misconception is still that obesity is just a lifestyle problem and not a complex chronic disease with its own distinct pathophysiology. So similarly, in terms of obesity treatment, many providers are still recommending lifestyle interventions, meaning diet, exercise, behavioral modifications, as really the ultimate care, when we know that if you look at the studies that look at lifestyle interventions or dietary approaches alone without a medical approach, only about 25% of people actually lose a clinically significant amount of weight and keep it off, and furthermore 80% regain their weight within 5 years.
So what are the most important changes you think the healthcare system needs to make in order to reverse the obesity epidemic?
So the standard of care now, per medical guidelines, is really a comprehensive and personalized medical approach to obesity. The problem is that only 2% of people who are eligible for this kind of treatment actually receive care. And so what we need is to improve access to care by training more providers and by improving insurance coverage for obesity treatments and obesity services.
So I know Intellihealth puts patients on personalized programs, personalized treatment plans. So can you give examples of how recommendations might differ from patient to patient?
Yeah, great question. So Intellihealth is really scaling and democratizing access to effective and compassionate obesity care. We do this through two ways. We have our software program and our app, which is called Evolve, and then we have our affiliated clinical services or telemedicine practice called Flight. And what we're doing is really, doing a very comprehensive evaluation, looking at all of the different factors that are leading to weight gain and all of the barriers that are preventing weight loss for each individual patient. And based on those factors, we develop treatment plans that address every single factor. So for example, we identify and recommend treatment for obstructive sleep apnea. We identify and recommend treatment for medications, we identify medications that are leading to weight gain, and we adjust those medications when we're able to. And then whenever appropriate, we prescribe anti-obesity medications.
Thank you so much for your time, Katherine.
Thank you for having me.